Hello and welcome to a session of e-learning with the Synapse. This session is the first of a 2-episode series entitled The Fall and the Rise of Measles. With us in the studio today we have Dr. Christopher Barbara,
Hello,
the clinical chairperson of the pathology department at Mater Dei Hospital, with whom we shall be discussing the happenings which led to the re-emergence of measles, as well as the steps which we healthcare professionals can take to limit the damage caused by this re-emergence. Dr. Barbara, thank you very much for accepting our invitation.
Thank you for the invitation, and it's nice being here at Synapse.
Thank you very much. I would like to start by saying that it's somewhat of a disappointing surprise that after years of barely hearing about measles, and us healthcare professionals being looking forward to hear the announcement that measles has been eliminated, measles has once again become such a relevant topic, since as we all know, it has made a re-emergence in a number of countries and unfortunately not least in Malta. Can you briefly guide us on what led to this re-emergence of measles?
Yes, of course. Even in the United States, back in the 2000, they even declared the elimination of measles from the country. And we all know today that this is far from the truth. Every week, once a year, World Health Organization and the European Centre for Disease Control in Stockholm celebrate the success of vaccination. And we know there is an excellent vaccine which protects us against measles. The problem is that one of the most influential journals, which is The Lancet, years back published a paper written by Dr. Andrew Wakefield et al., where there was an association between the measles, mumps, and rubella vaccine, because this is a combination vaccine, and autism. Since that day, there have been so many papers where studies over hundreds of thousands of children have confirmed that there is absolutely no association between the MMR vaccine, the measles, mumps, rubella vaccine, and the autism. So unfortunately, there was a gap in our generations where these children, or adults for that way, were not protected or were not vaccinated against measles. So today, thankfully in Malta, we still have our parents who are so careful about their children, who vaccinate their children. Our uptake for the MMR vaccine in Malta is 96%, which is the threshold which WHO is trying to aim for. Unfortunately, that is usually given at the 13 months of age. When you come to take the second booster dose, so that you give the protection even more for those who did not seroconvert, a lot of parents or some parents do not go and give the second dose. So I think it's very important for us health professionals to give and educate advice to our patients to continue their full vaccination. These 2 doses of vaccines will protect the majority of our children.
What can you tell us about the measles virus? What kind of virus is it and how is it transmitted?
Yes, measles virus is also known in Latin as rubeola, which is completely different to rubella, which is German measles, which doesn't have so many complications and adverse effects as this particular virus. The measles virus is genus morbilliform virus. It's an RNA virus and it belongs to the family Paramyxoviridae. Okay? Now it is an RNA virus, negative sense, and when it multiplies in our body, it needs the RNA polymerase. But one interesting factor which we should know is that this is one of the most contagious viruses which we have on Earth. Some articles even say that this is more infectious, more contagious than the Ebola virus. Okay? We have to really confirm that. But it is very important that when we get a case of measles, going back to your first question, knowing that there are gaps in our immunity in our population, if we get one case, then you can get other people who suddenly catch the infection. It's like lighting a match when you have a can full of petrol, okay? So we have gaps of lacking immunity for measles, and this is why we're suddenly getting all these cases.
What is the chance of someone who is not immune against measles being in the same room with someone who has measles getting the infection?
Very interesting, of course. I already said how contagious it is.
Exactly.
If you have measles and someone is not immune in that particular room, 90% of those non-immune individuals will catch the virus, will get the measles. So this is very highly contagious. How is it transmitted? It is transmitted via the airborne route, respiratory, via droplets, when we cough, when we sneeze, and even if we have contaminated surfaces. Sometimes I watch the students during the lecture. They're all the time touching the benches, then touching their faces, their eyes, the mucosa of their mouth, and this is how the virus enters our system. It then goes to our respiratory cells, okay? It fuses to the membrane of the host cell. There are various fusion proteins and so on. I won't go into a lot of detail. And then it enters the cell, and then with the RNA polymerase, it multiplies. There are dendritic cells which carry the virus to the lungs, to the lymph nodes, okay, to the blood, and as well to the intestine. And that is where we get all our problems and complications.
A bit of a practical question. If there is a confirmed cases of measles in a waiting room, how long should a doctor take to readmit the next patient to prevent this next patient from getting measles?
Excellent. The virus remains lurking around airborne on the surfaces for 2 hours. Okay.
Can live on a surface
So of
for 2
course,
hours.
if you have any patient who is confirmed measles or you are suspecting measles in your clinic, please do not admit another patient in that clinic for another 2 hours. This is what we're doing even in health centers, in casualty and so on. When we confirm a case of measles, that room is kept closed for 2 hours
It's a very,
before we
very
admit
important
another
thing
patient.
to
Because
know in a practical
people
scenario.
will catch it very easily, especially if these children are not immune and have not been vaccinated.
Dr. Barbara, we are in a situation where doctors who graduated maybe 30 years ago might have seen some cases of measles. However, doctors and healthcare professionals who have graduated since then have probably never come across a case of measles, but are now in a situation where it is very realistic to probably expect seeing a case.
Pity, I don't have pictures when I was a young boy because I had measles myself.
Okay. So
And what they had done, my mom, all right, is got my neighbor and we shared the same room so that he gets the measles as well. And this is what they used to do in the past. But today we are very lucky. We have this very safe vaccine, and so we should really immunize. But as you say, Maria, it's so important to know what features, how the measles is going to present.
How does it present and how is it actually diagnosed?
So if on day 0 you encounter the virus, as we said, via airborne route or via contact, okay, then you have an incubation period since the virus enters the body of 10 to 14 days, okay? So there are 10 to 14 days where the virus is entering our respiratory cells and in our lung. After those 10 to 14 days, you get what is called a prodromal period. In the prodromal period, you're going to get a high fever and 3 C's. The 3 C's are cough, conjunctivitis, and coryza. Coryza is the upper respiratory symptoms of the stuffy nose, etc. Okay? Also, in the prodromal phase, you get what is called an enanthem. This is before you get the rash. The enanthem is those white spots, they are like specks of salt, which you get when you examine the inside of the mouth, just opposite the molars, okay? Maybe you will be seeing some picture of this enanthem. These are called Koplik spots, okay? And for the observant doctor, they would notice these white spots, which are characteristic of measles, but they don't always appear. And you get these before the appearance of the rash. After the complex pepsa, so after this prodromal period of 3 days with the fever, cough, conjunctivitis and coryza, and the conjunctivitis is very evident, the child appears miserable, okay? Then you get the exanthem, which is the rash, maculopapular. Now maybe we shouldn't really use, it's either a macule or a papule, but it's really flat but slightly raised, okay? And very interesting, the rash starts from the head and extends caudally towards the legs, okay, within a few days. Within 4 days, you get all this rash spreading throughout the body, and then it fades. So very important, we realize that this is the period when the virus is mostly infectious, mostly highly contagious. 4 days before the appearance or the onset of the rash, till 4 days after the onset of the rash. That is the most infectious period for the virus. And usually that is the time when the child or the adult with the rash is coming to see you, okay? So very, very careful, and all healthcare workers, make sure you have been vaccinated against measles, because you can catch the disease very, very easily. And then you get recovery, which usually takes 10 to 14 days. So that is, in a nutshell, what happens in the life cycle of the measles disease.
We have already mentioned vaccination. As we know, you have just described the usual presentation of measles. However, there are some patients who aren't so lucky and experience much more serious complications from measles, which makes prevention even more relevant and important.
Very important.
What can you tell us about the possible complications of measles?
Yes, we looked at the pathogenesis, how the virus enters the respiratory cells going into the lungs, okay? In the lungs, it causes a pneumonia, and it could be a severe viral pneumonia with the measles itself. But at the same time, the measles virus is an immunosuppressant, and there is suppression of the immune system, so you get superimposed bacterial infections, and you're going to get a bacterial pneumonia as well. So you can see such a poor child or a poor adult with his immune system suppressed, getting a viral pneumonia, a bacterial pneumonia. You can get an otitis media because of the immunosuppression, but that's not the only organ which is going to be infected, the lungs. You're going to get the intestine because the virus travels to the intestines as well, so you're going to get diarrhea, which is not really so worrying, so we have to make sure that our patient is well hydrated. But then we're going to go to the brain, and the virus enters the brain, and we are going to get an encephalitic picture over there. And this is where the serious complications are going to start. And all these, the pneumonia, the diarrhea and dehydration, and the encephalitis, can lead to death in some cases. All can be prevented with a simple, safe vaccine.
All these symptoms and serious complications you mentioned definitely highlight the importance of prevention against measles. And as we know, vaccination is the most important preventive measure against measles, and the decline in vaccination rates have already had a very big, disastrous role in the re-emergence of measles.
Let me add on to what you've just said, because this is very important, Maria. When a mom has been vaccinated, she is carrying antibodies in her bloodstream. Now, we said we're going to vaccinate a child at 13 months.
Okay.
Infants are the ones who get the highest complications, and these are the ones whom we cannot vaccinate because of the vaccine, and maybe we'll talk about the vaccine.
The importance of herd immunity. It is the responsibility of us healthcare professionals to also educate our patients that when they are
take the vaccine, but also the mother transfers maternal antibodies for the first 9 months to her child. So nature is protecting if the mom is immune. But if the mom is not immune, the child is not protected for 13 months. And infants are the ones who get most complications and have the highest mortality. So actually all moms should have been protected, especially now that we're getting numbers of cases in our country as well.
For sure, we will get questions from our concerned patients on the safety of the vaccine, especially given all the misconceptions that were surrounding the vaccine, which we have already discussed. How can we reassure our patients that the MMR vaccine is truly safe?
I think the fact that we have had hundreds, thousands, millions of children, adults who have taken the MMR vaccine without seeing these complications is evidence enough that the vaccine is safe. The vaccine consists of live attenuated virus, okay? So because it is live, it is going to give us a very good immunity. For those few who don't seroconvert, because usually with the first dose, about 95–94% will seroconvert, but this goes up to 97% if you get the second dose. So it's a very good vaccine, getting good immunity, and this will last for the rest of your life. And the mom is transferring immunity to her child as well. So I think we have a safe vaccine today, so that we avoid the pincushion effect with lots of needles in the children. We give this as a combination vaccine together with rubella to avoid the congenital rubella syndrome, to avoid mumps, because that can also have its complications. And today, besides that, we also have other types of combination vaccines where the MMR can be combined in it as well. So I think we're giving safe vaccines on a plate to protect our children, to protect our adults. WHO, ECDC celebrate every year for a full week these vaccines. So all it takes is for us to protect ourselves and our children.
We mentioned that children are usually vaccinated at 13 months of age and then again at school age.
Yes.
But can adults take the vaccine if they know that they have not been vaccinated when they were young? Is it safe for adults to take the vaccine later on in life? And is it offered to some populations free of charge to the NHS?
As it stands here in Malta, anyone who was born from the year 1983 onwards can take the vaccine free of charge. So if their parents missed to give the vaccine and you have done some reading and know that this is so important to protect you, yes, you can go to a health center, but please phone so that you make an appointment. Floriana Immunization and all health centers have the vaccines, and this is given free of charge. The MMR vaccine is still not an expensive vaccine, so those who were born before 1983 can go to their family doctor, and of course, I'm sure all family doctors are going to suggest taking the vaccine, but it costs very, very little.
Dr. Barbara, in our practice, we might encounter patients who are uncertain on their immunity status against measles. What is the best thing to do in such a situation?
Just go and take the vaccine. I think I'd rather, it's such a safe vaccine that if you're not sure or you have lost your records about immunity, it's a safe vaccine, go and take the vaccine.
So
there is no need to go and take your blood levels to check your IgG levels, okay? So that is very important that you just go and take the vaccine. But you bring me to another point, Maria, because it's important to tell our health professionals. If you're suspecting a case of measles, we have to take a sample, and we're going to check using a capture enzyme immunoassay for the IgM to check for acute infection or an IgG to check for our protection, okay? But in most cases, we just want to make a diagnosis. Now, we know that in children, it's not nice, especially the parents seeing their children having blood tests. So we can also take a buccal swab, which I think we will be referring to in the second episode, whereby we can check for the antibodies from the saliva and the mouth as well in the laboratory. And this helps a lot.
We have discussed the importance and the effect of vaccination as a preventive measure in the healthy individuals.
Yes.
However, as we know, and it brings us also to herd immunity, there are patients with special circumstances, such as pregnant women and also other patients who are immunocompromised, such as when taking chemotherapy or some immunological medications. What is the best thing to do? What can we do in this situation, especially given that the measles vaccine is a live attenuated vaccine?
I think you've already given the answer there. Since it's a live vaccine, although it's attenuated, if you are immunosuppressed, if you are pregnant, you should not be taking the vaccine. So in such a case, it is important to immunize everyone in the surroundings. This will produce herd immunity, okay? So like you can light a match, okay, but you don't light it where there is a can of petrol, okay? And this is the same thing. So remove all the petrol, vaccinate all the individuals next to this person, keep them protected. The herd immunity will protect them from getting the infection. But you cannot give them the vaccine.
Can never be
That is so important for many, many different infections. One important point I wanted to mention, just so we say everything about measles, once you get the measles with all the diseases, the complications and so on, after a number of years, the story is not over because you can get another complication, possibly after 7 years, which is called subacute sclerosing panencephalitis, SSPE. Why does it happen? It could be an abnormal immune response by the individual. It could be a mutated virus, okay? But this causes havoc in the brain. It's like a semi-dementia, okay?
Wow.
But then you start getting seizures, you get coma, and this leads to death. So such a simple, safe vaccine, okay, which is given in combination. Children get it free of charge, so you don't even have to pay. But we already said it costs so little, preventing all these complications in measles. And don't think this has been eliminated. It is going around with us.
Dr. Barbara, thank you very much for a very informative session. As a final concluding comment, as you know, our audience is made up of healthcare professionals, mainly doctors and pharmacists. How important is it that all healthcare professionals are vaccinated against measles for our benefit as well as for the benefit of our patients who might be healthy and even not so healthy?
Yes, my message is very simple. Know your science. We all have common sense. We all know what happens if you get the disease. We all know what happens if you are protected. You will not get the disease, you will not get the complications. So enjoy your quality of life, protect yourselves as healthcare individuals, but also educate the patients to take the vaccine.
Thank you very much, Dr. Barbara.
Pleasure, take care.
I invite you to keep following the synapse.net/CME for the second episode of this series, The Fall and the Rise of Measles. In the second episode, we'll tackle measles from a more practical approach and discuss what should be done in suspected and confirmed cases of measles, which, as we all know, is a very realistic health concern. I also invite you to conclude this e-learning experience by attempting the set of multiple choice questions associated with this session and downloading the certificate of participation, which can be used for accreditation purposes. Till next time, thank you for watching and take care.